If you see someone collapse or you find someone already collapsed, first, try to wake them. If they don't respond, call 911 and get the LifePak AED. Open the airway and check for normal breathing. If necessary, give 2 breaths. Turn on the AED and do what it tells you. It will guide you through the process. Now let's go through that in detail. Someone in cardiac arrest is unconscious and not breathing normally. They might not be breathing at all, or they might be gasping, or what seems like snoring. The first thing you should do is try to wake them by tapping or shaking their shoulder and calling out, "Are you okay? Are you okay?" If you can't get them to wake up, call 911 immediately, even if you're not sure they're in cardiac arrest. Tell the dispatcher that someone has collapsed and you can't wake them. Tell them you have an AED. Now go get it. If someone else is with you, one of you should call 911 and get the AED while the other starts CPR. Next, open the airway. Tilt their head back and lift their chin like this, and check for normal breathing. Place your ear over their nose and mouth and listen for breathing. Look at their chest to see if it rises. A person in cardiac arrest either does not breathe at all or has abnormal breathing. And again, abnormal breathing might be gasping or snoring breaths. If they're still not responding and you don't see or feel normal breathing, give 2 breaths. Now it's time to use your AED. Using the LifePak AED is easy. I'll give you a quick overview, and then we'll go through it again. Turn on the LifePak AED and listen carefully to the voice from the device. It tells you what to do. Strip the clothing off the patient's chest. Open the electrode pads and stick them to the patient's bare chest. Once you have the pads on, stand back while the LifePak AED decides whether a shock is needed. After that, the AED gives you more instructions for what to do until the emergency medical team arrives. Okay, let's go through that in detail. Set the LifePak AED on the same side of the patient as you. Press the on-off button.
Call for help now. Remove all clothing from patient's chest.
You've already called 911, so start getting the clothes off their chest. Do whatever you have to do to clear the clothing quickly. Lift it, tear it, or cut it off. Don't waste time being nice to the clothes. Some versions of the LifePak AED come with a kit that has a pair of scissors, but in this case, the fastest way is to just tear open the shirt.